This report is streamed live on our iHeartRadio app. Download it now.
The sun is up in full force in Palm Beach County, and temperatures will begin to warm up. It'll also be breezy, but that wind will begin to die down as we head later into the day. This evening looks great, chilly, but not as cold as what we were dealing with this morning. I'm Storm Team 5 meteorologist Tyler Malden for 1230 WBZT.
This report is brought to you by Lead Safe America. Does your child struggle to concentrate and pay attention? What looks like ADD or autism may actually be caused by lead poisoning. Lead is a neurotoxin. It can cause permanent brain damage. Find out how to protect your family. Go to leadsafeamerica.org.
1230 WBZT. The thoughts and opinions expressed are those of the sponsor and don't necessarily reflect those of the station or iHeartMedia.
Hi, it's Leah, here to tell you about Dr. Anthony Pannozzo. He's a pain specialist located in southern Palm Beach County, so if you are somebody that you know is suffering in pain, Dr. Pannozzo is the one you guys need to call. And make that call today, because living in pain is no way to go through life. Dr. Pannozzo has been in practice now for more than 49 years. He's treated more than 73,000 patients for pain. He's an expert when it comes to diagnosing the pain, and he has had huge turnarounds. In fact, people living with scoliosis, he has had nearly a 100% turnaround. Lumbar pain as well. If you've got lower back pain, if you're suffering with migraines or flat feet pain, maybe pain in your elbows, your neck, your shoulders, Dr. Pannozzo can help you. And the greatest thing is he can help you without drugs, without surgery, and without having to go through weeks and months of rehabilitation. Give him a call today. Set up an appointment. It's 561-381-5800. Tune into his show Sundays, 11 to noon. And now, here's this week's edition of the Dr. Pannozzo Sports and Medicine Hour.
Well, here we are on a balmy 46 degrees. So all you beautiful, lovely people up in Atlanta, and especially those in New York City, you can actually play golf today because the wind isn't that bad, Doc, and it's a balmy 46 degrees. So I am going to do what I was told by many people. I am going to give out the numbers for the hotline so you could call up and to speak to Dr. Anthony Pannozzo. Hi, Doc.
Hello. Good morning.
I didn't wake you, did I?
Yes.
Okay. It's 800-889-0267, and that's the hotline. This is worldwide. You could call and not cost you a single penny to speak to the Benown. Is it Benown or Benone? Benone doctor.
What's the number again?
The number is 800-889-0267. I not only have the doc here tell me what to do, I have our producer and our director there. Hey, Freddy.
Yes, sir.
We're going to be doing a seminar here. Why don't you tell everyone where it's going to be and what time that seminar is going to be?
The doctor's having a seminar on Tuesday, February 16th at the South County Civic Center.
Wow.
That's on Jog Road in Delray Beach.
What time?
It starts at 3 o'clock. The seminar will be 4 to 5.
And it's free.
And it's free. And you can call 954-303-9563 for more information. And tickets are limited. It's not a huge place.
So now if you don't want to call and you get there and we have to turn you away,
you come back to the second seminar.
Come to the second seminar. Or wait there. We'll get rid of some people, right, Doc?
We're going to record this, right?
Yeah, of course we're going to record it.
Be recorded.
We're starting. We're going to be like Madonna. He's starting his world tour. So now let me just say good morning to everybody. How's everyone doing? How do you like this cold weather?
I don't like it.
I know.
I moved to Florida to get away from this.
Hey, it's one of those things. Imagine those poor people in New York. Now, please, we really feel bad for you.
Did you hear the snowfall amount?
Oh, wow.
11, 15, 20, 30 inches.
Wow.
It's crazy.
And the worst part about it is you can't even get a flight out.
What do you want to get a flight out? You don't want to be there.
No, you want to be here. So, Doc, I got a lot of good stuff to talk to you about today. I'm so excited. I was up all night yesterday. Yesterday I put in some questions for you. I didn't want to show them to you for a reason. So now here's what I want to do. Right now, I think people don't understand the difference between relieving pain or helping pain and the cure. And there's so many products out there that say we could help you get rid of migraines. Now, does any of this stuff work?
No.
Why?
Well, first of all, they don't know what causes remember SOURCE? Mm-hmm. SOURCE. SOURCE.
Tell us, do it again, because Freddy,
he's a little slow.
Okay.
SOURCE.
Source.
Source of the pain. So a migraine is a pain.
Mm-hmm.
But nobody knows where that source is. I do, because we did research on it. And by the way, we have had no recurrence of headaches, migraines, since we started doing this, and also vertigo.
We're going to talk about vertigo.
I mean, do you know what that means?
Yeah.
No recurrence. I mean, this is months now.
Well, what it does is that means people have to keep coming to the office, or else we can't afford to do the show. No, I'm only kidding. But the main,
I'm always working myself out of work. You know?
I know. Well, yeah. Let me give you a couple real great facts here, Doc. One of the things about migraines is that they have medications that are very expensive. It's
true.
Tryptophan is the main thing for migraines that they give a shot in the tushy, and there's derivatives of that same thing that go from $20 up to $605 per shot. But it just gets rid of the.
That's not a direct hit on the sub. It's supposed to produce something else.
Yes.
To treat your headache.
Right, but it doesn't get rid of it.
It would never get rid of it,
Right.
because they don't know where it is from. But I do, and we get rid of it.
So here's what people going to say. People that have just tuned into the show, because every month, every week we have almost millions of people that tune in, and a lot of people might feel not so good to have to call up on the air, so they write in stuff, which I have now. Why? How could you, nice guy from Delray Beach, find a way to cure migraines when the whole world says it can't be cured?
Well, because they don't have a source. If they had a source, they could do it.
Explain that to people.
They don't.
The source.
Well, it's into the hands of neurologists mainly. So if you get a headache, you go to a neurologist.
Right.
It's not a neurological problem. It's a musculoskeletal problem. So once you define where it is and why it is and so forth, then you could do research on it like we did. And in my office, if I want to try things out, I mean, we can do it there, because there's a lot of people come in. So this works.
Oh, yes, I know it
Absolutely
does.
works. And what else can we say? If you don't take advantage of it, I mean, you're missing something good for you, for your life. Don't put up with headaches.
And if you want to see some of the people that have gone to see Dr. Pannozzo, you could go to his TV show, which was Pannozzo, PANNOZZO.TV, and you can actually see people that have gone in with migraines, people that have had scoliosis, people who have had falls or hurts, including myself and Freddy and Freddy's son. I mean, for a father to bring his son in, how old is Gio? 21?
He'll be 20 on the 31st.
20, and guess what? You didn't even have to give him a shot. You fixed it with your custom-made, patented wedge that you put in the shoe, and the kid's fine.
Yes, that's true.
Amazing, right?
No, it's just a science.
Well, you know what? I think what people get lost. I just want to say a lot to the naysayers. We do not, and have never done on this show, knocked any orthopedic surgeon. We have just said that there are choices in life that you have the opportunity to make. If you want to go for surgery, that's up to you. But if you're happy. A lot of people go for surgery because they feel good with that drug that they take. It makes them relax a little. I think Freddy's on the drug. He hasn't said a word all day today.
Well, I'm just listening. I'm listening to what you're saying, but it's very true, because a lot of people just don't realize what you're giving up. Everybody looks at the glass half empty, and they go, Dr. Pannozzo, you're a great doctor. We've heard the show. It's so wonderful, but I don't want to take a chance because I've never heard anybody else do this. You're not the norm. People, you go to the doctor, say, here's a prescription, here's a pill, here's a magic pill, here's another pill.
Actually, what we do is the norm.
Is the norm.
Giving pills is not the norm.
No.
That's right.
Of course, one thing I've learned with Dr. Pannozzo is when you give a pill, it works on the mind. It makes the brain feel that you're okay. Is that correct, or am I saying the wrong thing? It makes your brain feel like you're okay.
It numbs the sensation.
Right. But it doesn't cure it.
No.
Okay, so now, I mean, I'm not going to mention any names of the products. Of course, they have a lot more money than I do, and I don't want to be sued. But there's a lot of people that's talking about an aspirin-type thing that gets rid of migraines. So it doesn't get rid of the migraine, just gets rid of the feeling, right? And then they can get it back.
Well, anti-inflammatory, which is what aspirin is the best treatment for it. Not those expensive things, but aspirin, plain little aspirin from the drugstore, any make, 325 milligrams. You take 3 of those, and that knocks any headache out.
But it doesn't make it go away forever.
It may not go away forever because of the situation that causes that, the source. And but we get rid of it.
And here's something funny, Freddie. Remember
Notice-
when we first... Go ahead.
ahead.
No, go ahead. You're the doctor. You can talk.
I
Somebody talk.
want the people to understand that
Right.
we have had no failures
No?
for migraine or vertigo in 3 months, 4 months now.
And also TMJ.
Yeah, well, TMJ is another issue.
So everyone that has that mouth guard in their mouth that a doctor, I must say, who put it in, that cost you $2,000?
Yeah, TMJ.
Let me tell you something. If
Why
I-
do they put the mouth guard in? I don't.
I always thought the mouth guard was because you go back and forth with your teeth and
You're grinding your teeth.
you're grinding your teeth. I don't see how it gets rid of TMJ.
Actually, they're misinterpreting what the grind means. The grind means that your body is telling you there's something here to take care of this, and so you start grinding on it. It's just a symptom, and you have to take care of that thing. And what it is, if it's TMJ, it's usually a bite problem in addition. So you take care of that, and then you take care of the bite. And very few dentists want to spend the time doing bite treatment, though. They have to sit there and they have to put the paper in there and have you grind on it and see what, and then they have to interpret what they see. So if there's more ink, so to speak, then they're grinding more on that. So they want to loosen that one up. They grind it down. But you start doing that. It's kind of crazy. So they don't really, dentists don't really get involved with the bite that much. There are some that do. The oral surgeons do because they have a product they have to do. So they do that. But the ordinary dentists, they don't do it that much. I don't know. They should. There's money in it, gang. Do it. Take care of the people.
So where does TMJ come from? I mean,
It's a misuse of the joint.
Okay.
Temporomandibular joint right there.
So when they put that mouth guard in there, they wear that all day?
At night, I think,
At
right?
night.
At night. So
So
at
you
night you
don't
recover?
what? So you don't what? Grind.
Grind. But don't you grind during the day?
No, not really. I don't think so. They gave me one of
Yes.
those 20 years ago.
Yes, you do. But see, they just want to get rid of the symptom at night. So
They want you to think they're getting rid of it.
And they don't.
No.
And it's the worst thing you could do is I tell people, throw that thing away. Get your money back because if you wear it, it holds your jaw in a position where the ligament structure gets stiff. And now you really got a problem after a while.
Yeah, that's the thing you don't want to do. Well, I learned something from you when lifting weights in the gym. They never wear a belt. You know what? All the guys that used to wear belts now have back problems because when you take the belt off and if you bend down to pick up something, you've not given the back muscles a chance to.
They put the belt on because they had a back problem.
I thought
Okay.
it was to
Cause and
stop
effect.
hernias.
Remember cause and effect now.
Yeah.
It's to stop hernias. You're going to get a hernia no matter what.
I did. No, not a hernia. I got a hernia.
Nobody gets hernias. Who gets hernias?
I got a hernia. I had it surgically repaired.
From that?
Oh, no, I had a groin injury. I'm sorry.
I used to lift stones, and my intestine came out of my belly button, and I had to put the mesh in there. Now they're suing doctors because of that mesh. Did
Yeah.
you see it on the news?
Wish they quit suing doctors. I mean,
It's crazy.
you
But
do
they
what
sue
you need to
doctors
do
for
at the time.
No, I mean, people,
and then
let's
they come
face it.
back later and sue you for
That's unfortunate.
what?
I never
because,
su-
I
because
never-
we tried to help you. Is that why you're suing us?
No, I think
I didn't
that's
sue.
terrible.
No,
really
I
do.
didn't even call.
By the way, I haven't had any suits.
Yes, that's true. No, well, let's face it. You don't give medicine. You don't give surgery. Or you either help them, you don't help them, and what you give them is in and out of the body. It's about 8 hours.
Well, mainly they're happy.
Oh yeah, I haven't seen one unhappy person.
Patients are happy. That's why they don't do that.
And I offer that same thing to anybody. If you're unhappy,
It
please
goes-
call us up.
It goes into the scenario that we're talking about, this reality show.
Yeah.
The part of it you want to watch is the scenario, and that tells you everything about that pain, where it is, why it is, how you got it, what we can do for it, and it's in that segment there that you want to listen to it. If we ever get this,
Yeah, but
No, we'll get it done.
I got the greatest name with everyone's going to. It's Dr. Anthony Pannozzo and the Kardashians. Come on, we can't miss.
Pannozzo meets the Kardashians.
Pannozzo meets the Kardashians. These people have a lot of trouble with pain.
They create more pain in there.
they're causing more pain in my brain than I can handle.
Well,
I mean,
the concept of our reality show that we're doing is we're actually going to show people.
you notice how they're getting rid of all the guys on that show.
Yeah,
Yeah, the women don't.
You watch the Kardashians, Doc?
It's on every night. You have to go through it to find out what channel I'm in
Let's
because
see.
I skip channels.
I know Colleen's young. Colleen, do you watch the Kardashians? Colleen doesn't want it. She's more intelligent guy than. It's like watching a train wreck, you know. Okay, but I can't knock it. They did very well. Okay, another thing, getting away from the Kardashians.
Yes.
Okay, what the show tries to do is tries to give you an alternative. I shouldn't say the word alternative. Another person to see before you go in for surgery, because I don't know any person that I know, unless someone out there could tell me they know someone that's gone for surgery that is 100% fine and is not taking pain relievers.
Right.
I mean, there is a lot of pain after surgery.
Yes, there's a lot of pain after surgery.
I mean, I don't care what you do. You're going into the body and you're pulling something out that shouldn't have been pulled out. You're substituting it for something else. So you got to have pain.
Well, let me explain to the people
Yes.
how you're
explain
supposed
that.
You explain, Lucy.
Explain that.
to explain.
Explain, Lucy.
Explain that.
So you know how to think about this. Surgery is an abnormal thing that doctors do. It takes a lot of effort. You got to go to the hospital. You got to be knocked out. They got to cut you. They got to sew you back up. All of that is unnecessary if you get treated right. So it's a failure of treatment. That's the way you have to look at it.
Okay.
So you should be going and looking for doctors to treat you besides the surgery. So you can always do surgery, but once it's done, it's done.
You can't undo
got
surgery.
Now you can't undo it, and you got scar tissue. You got other problems there. Some people may not even make it through.
Yeah.
If you get a blood pressure drop, which doesn't happen that much anymore, but they can take care of that pretty good. But still, you don't want to do that unless you have to. It costs money, especially if you have a large deductible. Yeah, large.
Well, a lot of
Well,
people.
well, hold on. Talk about money. I got a sports point that I want to ask you about.
Okay.
I'm very happy that the Mets signed Cepedas. Very happy.
A lot of money. Where are they getting all that money?
Well, they signed him for less money than anybody else, and he decided to play with them, which is so different. But it's been revealed that he hurt his left shoulder. They don't know how. They're not going to tell you how. But they put a cortisone shot in there. Okay? He was never the same after that injury from the time he got hurt to the World Series. And then he banged a foul ball off his knee that completely took him out.
Wow.
So my question to you is this, Doc. If a foul ball hits the knee, it creates inflammation, yes? Swelling?
Well, it depends on where it hits.
It hit him right on the front part of the knee.
Well, that could be just a bone bruise.
Yes. Okay. And then they put the cortisone in his shoulder, which prohibited him from swinging the extension that he needed. So when you have a big hole in the middle of your lineup that can't hit because physically he's unable to,
Well, that whole thing is ridiculous. I mean, the shot should have gone where the problem was, and he should have been hitting.
so can you imagine if that gentleman knew Dr. Pannozzo?
Yeah. Oh, we got a call. Who's calling us today?
It would have changed the course.
We would
of
have
the World
saved his
Series.
career. Like we.
Well, he's doing okay.
Oh, he's doing okay.
We have a question for the doc. Hold on. Okay.
Hit the button, Les.
Who wants to talk to the doc?
I do.
Okay. Who are you?
My name is Zena.
Hi, Zena. Oh, Princess Zena. You can talk. Go ahead.
No. I suffer from very severe scoliosis, which causes my spinal stenosis a lot of pain. A lot of pain because the bend in my spine is hitting the nerves, and so it hurts. And it hurts all the time. And I've been told that the cause is the scoliosis, and that I have to live with it.
Wow.
They told you that. Well, I'm going to tell you different. You don't have to live with that. And the pain that you're having is not from nerves. It's from ligament structure. And you're just pulling on ligaments, that's all. You know, once you explain what the pain is really from, it kind of takes the stress off. So I don't know where you are. Where are you, in Florida?
Yes, I'm in Coconut Creek.
Okay, well, you should make an appointment and we'll knock that pain down for you.
And he guarantees you'll knock that pain
Yeah.
down because we have a lot of scoliosis patients.
Absolutely, yeah.
Zena, let me give you his number, then you can call him off the air because he's one of the only doctors that actually answers the phone himself. So 24/7. Okay.
Okay.
His number is, ready? 561 38. Go ahead. 561 381 5800. And you can call him after the show, and he'll be more than happy to see you. And I'll tell you one thing. You could be our next person that's going to write a wonderful letter on how Dr. Pannozzo helped you get rid of your scoliosis. No, he's not going to get rid of it in one shot. I just want to let...
We are, a lot of it.
Yes.
It's just scar tissue.
And she can see the results herself.
And you're going to feel it and see it, and we're going to show it to you, how your bones change. And I think you'll be happy. This is routine business now. We did the research on this. And now it's routine. We just do what's necessary, and you see the result. It's really fascinating, even to me, and I do the work.
He's not just a pretty face, he knows what he's doing.
Well, he has video evidence that he has worked on it, and he has helped people with this.
Where can they find him on the video, Freddie? Where do they go to?
Pannozzo.tv. That's PANNOZZO.tv. It's in there. And he has cured many. Now, I was at the doctor's office this week, and there was a couple of people that were in there for this.
Yeah.
And they said the nicest things. I said, wow, this is unbelievable. Where have you been? Now, you've been here 50 years.
10.
10 years.
I know, he's been in practice no longer than 50 years. But
Feels like 100.
And it's nice that she called, because the bottom line here is that you can help this lady.
Definitely can help her.
And we didn't pay her to say. They told her, live with the pain, doc.
Yeah, well, usually they're going to chiropractors who cannot do anything with this. Absolutely, they can't.
They can't find the source.
Once you explain where it is, I would ask a chiropractor or a PT, I said, what program do you have for this? If this is where it's from.
Right.
They don't have a program for that.
No.
I do.
Well, you've been doing it.
We do, and it works. So come on in. You'll be fine. Thanks for the call.
Thank you so much, Gina. And please call up. It's going to really change your life. And what do you got to lose but time, I guess?
The pain.
Yeah, no lose. In fact, you could limp in and leap out.
All right, so what's the number to call in the doc?
You can call the doctor at 561 381 5800.
Why does your voice get lower when you slow down? What's the matter with you?
I don't know. I think I have who are you, by the way? Could you cure Alzheimer's, Doc? Thank you, Zena.
Doc, it's really interesting. David Wright was also diagnosed with the same thing she had, minus the scoliosis. They had the shrinking, it was tightening the spinal cord, which is what I thought stenosis was. But his injury is in the hip. All of that work that they've been working on his back, they've discovered. I don't know if you called them, but they're working on his hip now.
Well, he did that with Leah.
Well, he said it when David got hurt. He said they're looking in the wrong place. You got to look in the hip, and that's where they are now. 8 months, 10 months later.
Are they listening? I mean,
somebody's listening.
Over a year and a half ago, he spoke about concussions. And now they're doing, all of a sudden, concussion has been some. So evidently, someone out there is talking.
Want to talk about that?
Hey, let's talk about concussion.
Yeah, because that's big.
Johns Hopkins.
Hold it up high so people could look at it.
You got it.
He got it. Okay, go ahead.
Can't it be higher than that? Anyway.
So I can't be higher than John
Here's
Hopkins.
The conclusion. It's exactly what I've been saying for a while.
Yeah.
They must be listening too. I don't.
Somebody's listening.
It says, symptoms get lumped under the concussion umbrella, leading to a lot of confusion.
Talk in the mic, Doc.
This is a physician talking.
Right.
The same incident that causes a head injury can injure the muscles and nerves in the neck.
Mm-hmm.
When these injuries occur, patients may have lasting headaches. A fall or auto accident can also stretch the muscles around the eyes, affecting the oculomotor system. When the eyes don't work well, that's another issue. But you see, concussion, the term doesn't mean anything.
Mm-hmm.
It just, I don't know how they use it. It depends on who's using it. To me, it just says a little confusion. So.
Well, you once said that a concussion doesn't come from the brain because the brain is so protected. You said, if you listen, like Freddy was a coach, folks, so I'm talking to someone that's really knowledgeable about sports. Your neck goes back when you hit somebody on football, right? When that helmet goes, the head snaps back. That's the neck. So I'm a firm believer now. I'm not a doctor, but after working with him for so many years and you yourself being a coach, that sounds logical, doesn't it?
Well, they used to say you used to have scrambled eggs. And your brain used to get scrambled.
Yeah.
And then I even asked the doc, is there blood involved? Does the like does the skull crush the brain or something. None of that is true. So all the evidence is pointing in the wrong direction.
Yeah, none of it is true. And why? Because the team physicians are chiropractors, internists,
Trainers.
general practitioners, or surgeons. None of them are trained in musculoskeletal stuff like me. I'm telling you. Now, here's another thing. Pain psychologists meet physicians and patients. The best way to take care of a patient is to explain what the source of that pain is. And once you explain it, and it's so small, it does a lot of pain. A little ligament this big will do that. And
About the size of your thumb.
once they understand less, once they understand that, I have a big thumb. Once a patient understands where his pain is from, that quiets him down a little bit, gives it a chance to work. It really does. So, you don't want to spend a lot of money on psychologists. They don't know anything about it. All they do is try to tell you how to handle the pain. Well, if you know where it's from, you can handle it.
Well, you can remove all of that guesswork from Jump Street.
That's the problem,
They can come in and get a second opinion, third opinion, ninth opinion. But if they from Jump Street they come see you,
All right, now opinions. Don't go to 5 orthopedic surgeons,
you get the same thing.
and you get the same answer from all 5 of them.
That's
you
true.
think you're a never land. Don't do that. Go to someone like me who actually treats these things.
That's right.
And
See
we're
what
hard to find, but keep looking.
Well, yeah, it's hard to find. It's you and your son. That's it. So when you see here, this is a great one, Doc. I'm driving home, and I see this little office that says Pain Management Associates. Okay, is pain? I'm assuming. Well, I know the answer because I went in to talk to him. I'm assuming pain management is just getting rid of the pain, but not curing where the pain came from, so you can get rid of the pain permanently. Am I right?
Well, they're managing a pain.
Right, managing. I don't want to manage my
By
pain.
giving you narcotics
Right.
and other drugs instead of knowing where the pain is from and treating it directly. That's why we don't have to prescribe anything.
Mm-hmm.
I mean, you walk out of my office, your pain's down. It's not coming back.
We've actually seen that. And that's the beauty of it.
But I don't call myself a pain manager. No way.
So I want everyone to get that word out of their vocabulary. That's a pain management. But you know what I'm going to do
when
today?
they walk into a pain management doctor, they're willing to accept drugs or therapy or chiropractic or anything out there, acupuncture. It goes on and on. None of those are scientific. None of them are going to work.
Well, I got a new one for you. There is a company that's online. Ready for this? And they say that vertigo comes from bad liver.
Oh, excuse me.
Wine.
Bad liver.
Wine, and chocolate. Now, I've never had vertigo, and my diet is wine and chocolate.
Who is saying that?
Somebody who wants to sell a product, and here's the product, Doc. It's called. Hold on, I forgot. Hold on. Oh, wait.
Chocolate wine.
No. It's called Balance Again.
Balance again.
Yes, and you can buy a bottle of Balance Again. I have 5 different bottles. One is a thing you pour in.
You drink it?
You could drink it, or you could take a soft gel, and
what is it?
they're basically saying that
What is this stuff?
it's got 9 million herbs and
Now,
ginkgo
before
biloba.
you take anything, look at the label. And if you don't know what the stuff is, look it up in the dictionary or online. You've got to know what you're taking. A lot of that's filler. It just doesn't do anything.
Well, I'm going to make it easy for them. Go to Vertigo and Cures, and you can see there because they have a little, what do you call those things, a marketplace?
You have a
where
computer. Why don't you look at it?
yeah.
Why? Because I think it's
It's
ridiculous.
crazy.
I
It's
think
ridiculous.
just a
Waste time on it. Don't
ridiculous
go.
thing.
Don't go to
And
those people.
here's what else. They say that a lot of neurologists are now thinking differently about putting them on the thing and moving their heads around for the inner ear.
They should, yes.
Okay.
There's nothing in the inner ear.
But
Right.
there's ENT guys that do that.
Yeah, and those are throat guys. They clean out your ears and they go like that. Okay, you should be okay here. See this piece of wax here? That got rid of it, so you won't have vertigo anymore. Then you can drive it home like this. Whoa!
No, the worst thing is they change the crystals
Are there any crystals in the ear?
I have no idea. I don't think so. I remember back.
They changed the crystals. I've
Yeah.
never seen my crystal.
I mean, they taught this 100 years ago when I went to school. I mean,
I'll tell you, all I know is that thing that they put you on, I want those in the house. It makes you go up, it makes you go back. I mean, that could be good for something else, doctor, other than checking your crystals. I don't know what crystals are. You don't know what crystals are. Do you know, Freddie?
I don't even know what the hell you're
Colleen,
talking
do you know
about.
what a crystal is in the ear?
if you do this kind
Colleen
of
doesn't
thing,
know either.
the crystals go here. If you do this kind of thing,
Yeah, right,
the crystals
right.
go here. I have no idea what they're talking about.
So let's cut to the chase.
But we do treat vertigo. I want you to know that. Absolutely guarantee the treatment of vertigo will be out of there real fast.
I met 3 women. Let me ask you a question. That's funny. I met 3 women that had vertigo. Is that it?
It's just 3.
Well, because Doc, I can't live in your office.
Well, no. I met a gentleman that was there for vertigo.
I mean, it seems that every time I come in, I see another vertigo. I saw 3. I can't live there.
I saw one vertigo. He'd done one side, and the guy came in to get the other side done. And he's talking to me, and he says, "Oh, I can't even talk." And we had a conversation. I said, "But you're talking now." He says, "Holy mackerel! Can't believe this."
Just so
I know, that's a very funny guy.
just so you know, Freddie was five minutes from the doctor in a very nice country club. I live in Plantation. It cost me $22 to come up and see you. It cost Freddie a nickel and a half. So, Freddie's in a lot more than I am. But the 2 people that I met were in different ages. All three were in different ages. But again, they were women. Most of the people that I saw were women that had vertigo. Does that affect women more than men? Is it? No. So it's equal. And what fascinated me is all these people went and did what the advertisement said it was supposed to do. One person had to be rushed to the hospital because the doctor gave the needle. He gave it in the jaw. Right? Something she was telling us. He gave her something and she passed out.
I never understood that.
Yeah, I didn't either. But
there have been Major League Baseball players that pulled themselves out of the game because they have vertigo.
What about the golfer?
One of them plays for the Miami Marlins, and he was out for 4 months. This is the thing. I just don't get this.
I don't know why they don't come in and get it treated, because they don't know about it, and they're being advised by their trainers and their surgeons that can't be done, and they got to take a chance on it. It can be done. It is being done every day.
That happened to Jason Day, and I think in the Masters, was it that he suffers from vertigo and he just fell down. And he couldn't get his balance.
And get off the field.
Yeah.
You know, the other thing I was watching the other day is on the Jets, they had 2 trainers. A kid ruptured his ACL. And they put a boot from the bottom of his knee, his ankle, all the way up to his hip. And so they come over and they take some x-rays and MRI. No, they didn't do the MRI. They said that the next day they're going to do the MRI to make sure that what they think it is. But your season is over. You have a torn ACL. Yeah. And this kid, he was a rookie, and he's crying his eyes out.
Yeah, you know, it's a shame because they're not educated, these guys. They know how to hit the ball, and that's about it. And they believe everything they're told.
Everything they're told.
Okay, now
it's a shame.
I got a lot of questions. I want to read some questions. So we gave you kind of an idea what doctor does, and I want to ask some. I don't want people to think that we don't read the questions. So I'm going to start with New York today. You ready, Doc? Paul from New York. What's in that, Doc? Tea and a little vodka? Paul from New York City writes,
No vodka.
As the snow comes down, I have to get out there and dig my way out, and old ailing back injuries are calling. It's been years since my lower back hurts, and now that I am older, I don't think I could go through another winter of ailing back. Will you ever be in New York City anytime soon, and how could you resolve my pain?
Well, we can't do any treatment in New York because I don't have a license there.
Okay.
Unless we get a waiver of some kind, but I don't even think they do that.
No.
Let them come down.
It's very political, you know.
No, let them come down.
Yeah, you're better off just coming down, have a vacation, 2 days with me and 5 on the beach, and you'll be great. Go home.
Lower back pain, common, Doc?
Very common.
That saying? It could be a multiple of things?
Well, the scenario we talked about actually takes all the history and the clinical exam and special films and tells you where it is and why it's there, and how we can fix it, and we do fix it.
So you use something called a $300,000 plus thing called the SEOM, okay, which shows everything. Yes, it's actually more. I looked them up.
It's 200,000. Yeah,
well, it's a little more now, about 300,000.
He's going to buy it. That's why he's discussing the price of the machine on the air.
No.
Jeez.
Well, it was between the SEOM and a Bentley. And since I can't afford either one, I decided to use his C-arm and drive in his Mercedes. That's okay.
But hold on, now that you brought the C-arm helps the doctor place the medicine, right?
Yeah, it's a locator of
It's
bone
located.
structure. Yeah,
It's not
ligament
what you
structure.
use to
that's how we use
determine what it is.
It's not a diagnostic tool.
Yeah.
No.
So, in other words, so I want everyone to understand, you have the C-arm that shows where you're going to place the needle. Now, a chiropractor. Now, again, folks, I'm not knocking anybody. I love everybody. I just want you to understand that you have a choice. Now, to me, a chiropractor doesn't have that machine to find out where that injury is. Correct?
They can't do it. They can't use medications. They don't inject.
Right. And also a orthopedic surgeon, again, who I love them all, cannot, with an MRI, find out where that cause of pain comes from.
MRIs will never give you the scenario. The scenario means where it is, why it is, and what it can do for it. You don't get that from an MRI.
Well, not only that, is you've been to doctors before you met him. I've been to doctors. Has any doctor ever done two things to you? They never did it to me. I'm a little older than you, so I've seen a lot more doctors. Do they ever ask you, where does pain come from?
No.
Okay. Did they ever say, look, I'm gonna put you into surgery, we're gonna do this, put this in here, and I guarantee you walk out of that thing and you'll never have any more pain again?
No.
Okay, me either. Okay, so do you guarantee
Absolutely.
everything? And if it let's just say it hasn't happened yet, it doesn't work, what do?
Look again.
Thank you. Okay. So to make a statement like
But see, when I hear that, it didn't make it. It's worse. It's a baloney. These shots are cures.
I know
in
when someone will come
themselves.
in.
And if you don't argue with me over the phone, you come in, we'll re-examine you, and I'll show you what you have now. I mean, after all, I have to have a chance to fix these things if you're not happy. But most of the time, it's based on the fact they don't want to pay for it.
Well, yeah, that's true.
Well, the bottom line here is that it's only fair to the doctor if you come in and you do what he tells you to do. If he says you got to come back a couple of times, if he does miss, I haven't seen him miss, but if he does, I mean, he's human.
Yeah, if you're going to another doctor and don't ask me about it, that means you're doctor shopping,
That's right.
and that's the best way to lose. You absolutely will lose every time you do.
Shop for a new car. Don't shop for medical attention.
Right.
Well, I've seen people in his office arguing with him because of medication. And the doc says, no, I don't do that.
He was there when somebody wanted to hit me because I wouldn't prescribe
hit you?
anything. I said, I don't have to prescribe anything.
I said, look at the freaking sign. I said, freaking, is that okay? Colleen, I said, freaking? I'm okay, good. Colleen looks like a
You got to
bad
settle
lady there
down.
today.
I mean, what are you drinking here?
I know,
Coffee?
he's like, what?
I don't think she gave me decaf. Right?
I don't think so.
She was so enthralled with you that she screwed up my order. Okay, now we're going to go to another New York question. Johnny from New York City writes, I've seen a couple of your shows and was interested in the vertigo cure. Wow. You say you found this by accident and now trust that the vertigo will not come back. Have you had many vertigo patients? Do they ever come back for, hold on, next page, give me a chance. For ailments? Why hasn't this cure been announced to the public?
I'm announcing it.
Okay,
I mean,
public,
what else you want?
if you have vertigo.
Who do you want to announce it? Let's delve into this.
Okay.
He says we didn't announce it. Actually, that's what we're doing.
Yeah,
That's how he found it.
But in his mind,
That's right. That's how he found it, by listening.
in his mind, he wants some expert somewhere that he doesn't even know
That's
about to
right.
say it.
That's right.
But they don't think that way.
That's right.
It's a thinking process.
That's very smart. You're right. He's right.
In research, you will get what you aim to get, but you have to set it up right, and that's what we do. We're good researchers.
Dr. Pannozzo, for this job, and John, I just want to let you know something, is a graduate of the Big O, Ohio State University, which is one of the most prestigious colleges. The Big O. And as the Greek said, he lost money with the Big O. Okay, but the bottom line is he's a medical physician who's practiced medicine, who's interned, did everything else, and decided to go into musculoskeletal because why? What made you go to musculoskeletal?
Well, I was broke, and I thought that was a good field for me.
I mean, you're not going to find a Dr. Moranis in this guy. I mean,
we all have the same problem, We come out of school, now we got to make a living,
Okay, now we get.
But I think in terms of solidity, like structure, and that's how I think, and that's how you have to take advantage of what gifts you have.
That's right.
Find out how you can do it.
Yeah.
If you're a good memorizer, you're not going to do what I do.
No.
We have to understand everything, and it has to fit the laws of physics. It's got fit design and function. It's got to fit a lot of things. A sphere and a cube. I mean, there's different functions, and we have both of those in our body, by the way. So
Dr. Pannozzo is the pain whisperer. 561-381-5800 if you want to talk to Doc on the phone.
What was that number?
I forgot. 561-381-5800. And that's a toll-free number, by the way. Just pick up your phone and you can call them. Here's someone that's...
Hold on, before you
it's a
get into...
toll-free number.
Okay.
It's not a toll-free number.
Before you get into the next question.
Okay, go
Tuesday,
ahead.
February 16th.
February 16th.
South County Civic Center, 16700 Jog Road in Delray Beach. Dr. Pannozzo at 3 o'clock will be having a seminar. 954-303-9563. That's 954-303-9563. Come and meet the doctor. Bring your pains. Bring your pills.
Now, 1 second before you go, you could also email and make your reservation at mllm46@aol.com. Or if you want to take a chance and show up, please understand one thing. It fills up very fast. And the one thing the doctor's going to do, he's going to start from the head, Freddy, and work down to the toes and show you all the things, how he can help you. You could ask any question you want, and he will answer them.
And if you want to bring your MRI, bring it, and I will hold on to them and give them back to you. Don't give it to Dr. Pannozzo.
Yeah, or give it to me, and I'll give it to Freddy. Okay, here's someone that's right around the corner from you, Doc, in Boynton Beach. I hope I'm not pronouncing your name. Daniela, she's from Boynton Beach, and she writes, you have been on the air for a few years, and I've been reluctant to go in and visit. Okay? I suffer from scoliosis, as you described many times on your show. I didn't think anything could help me, and though I listen to almost every show and watch what you post, I think I am ready to see you. You have a seminar coming up soon. Can you share any information about what's going to be discussed? I want to make sure that all the testing for this ailment have been exhausted.
She's talking about the scoliosis.
Okay. You want to answer this question? Go ahead. I just told we are going to be discussing everything at the seminar from head to toe.
What was the question?
I don't know. I forgot.
That you've uncovered all the testing that you've been doing for scoliosis.
There is no testing for scoliosis. You have to understand what it is. There is no testing for it. It is a malformation of the spine due to scar tissue, which means you had to fall, you had accidents of some kind, and it scars down that way and stays that way. And it happens usually when you're younger. It gets worse as you get older, and you get more pain for it. But we know where it's from. We know where the scar tissue is. We can pick it out, and we can relieve it. And we do.
And you show them.
And we show them.
Yeah.
Football players, Doc, are constantly being hit.
Oh, they're going to have scoliosis. I mean, you look at some of them.
They're going to have what is defined as scoliosis, because you told me that's not even the correct word to use. But all of those hits on the back, eventually you're going to have swelling back there, correct?
You're going to have a displacement of structure. The bone will be displaced. That's the term for it. And when it does that, it's because of an injury. And if you let it go, then it'll keep you that way. And so that gives you a weakness on performance because you're not straight, you're crooked.
And it just keeps growing and growing?
It just goes simple like this. You have to break it down to simplicity so everybody understands it. And this is really simple stuff if you look at it the way I do. You have to know the structure. There's ligaments in there. The ligaments get stretched, then they solidify in a crooked manner. So your bone is not here, it's here, and every time you bend, now you got a pain. And you say, where did that come from? Well, that's what the scenario is about.
It keeps getting worse and worse.
When you get, it does, and when you get evaluated in my office, you get the last piece before we take the pain away is a scenario. I'm going to explain what you have, why you have it, and where it is, and what we can do for it. And you get all of that at the end. And it's worth the price.
Well, the beauty of it is that what's amazed me is he shows a patient on the C-arm what's causing it, and then when he gives the shot in there, the patient actually sees the spine moving, and that you could actually see it. We know of someone that gained how many inches?
3.5 inches.
3.5 inches.
You know what I'm doing now? I'm having everybody take a picture with their camera. Take a picture of your back.
Oh, that's a good idea.
As it turned. and they take a picture and they have it. They can show anybody.
Before and after.
Yeah,
That's
it's
fantastic.
good.
Great idea.
It's really a nice idea.
You know, and a lot of players that I coach, there are a lot of leagues in Florida and the country where you go into the hospital, they send you to a chiropractor. And that's what they do with these
That
kids.
is a shame. You know, that is malpractice right there. You can't send people that have an important thing like this to somebody like that. They're not trained for it. It's a trade school.
Correct. So all you guys out there who've been playing in the different leagues, USFL and things like that, come and see Dr. Pannozzo. And I'm talking to you as a coach. You know, there's no way of taking out those pains. I mean, hands, backs, knees, all from the contact.
Well, what they're doing, if you go to that, they're going to put a stimulator pad on you. Electrical stimulator. That does nothing except go from pad to pad. It has nothing to do with where that pain is.
They saw it on TV.
If you don't know where the pain is, you're going to send it to a technician like that to find out what the pain is? People do that all the time. It's a thinking process. Don't do it. If you don't, as a physician, if you don't know what it is, send it to another doctor, not somebody who's going to play with them. I mean, you don't know what those people are doing. Ask me. I'll tell you what they're doing.
Well, eventually you're going to be going to this guy for X amount of months. You're going to go back to the doctor. He's going to say, well, listen, I tried. Let's go in for surgery. That's what's going to happen.
Mm-hmm.
That's exactly what happens. And it's not necessary.
That's right.
Well, here's something that's really something that people should understand is when they see you, nothing you give can hurt. It might, let's just say for argument's sake, it might not cure them. Let's just say, which I know that hasn't happened yet because no one has ever come back. But nothing he does is going to hurt you. It's when the only ones at the NFL and the AFL and everybody else is not on their list of a bad steroid. So if an athlete gets it, it doesn't hurt them. It's not a performance drug at all.
No, it's not that kind of steroid.
No, and you being a coach, you've been a coach for so many years. I mean, you know how many games you probably would have won more than, everyone loses some, that you had to let your number one player not play. How about golfers? Just the average golfer whose life is golf. You could cure their golf swing.
Well, we have. Yeah,
and we have pictures of that too.
Yep.
Well, it makes me want to go back into coaching.
Yeah.
As a scout.
No, we need you right now.
As a scout, and go to schools, go to high schools. Now high school seniors can get agents. Wow. But to go in and watch these kids that are injured, and to put them in the right path so that they have a chance. Like the kid they called about his pitching arm, his mother didn't let you work on him. That's a true story.
Yeah, I remember he was telling me. Yeah.
And he told her, listen, this is what we have to do. And the mother said no. I would love to hear from her where this kid is going to end up.
Yeah, she's not going to fess up to it because he's not going to be handled right.
He's not.
No, because they don't know where the pain is. That
Absolutely
the shoulder exam is really, we worked on this a long time.
Yeah.
It is absolutely first class. This is the best you can get. Yep.
Well, I mean, to find where the source of the pain comes is very important. I mean, for someone to look at you and say, here's where the pain is coming from, right here, and I could fix it.
Well, we also have the C-arm that
Yeah.
we look at the joint itself,
Right.
so we can tell by that where the scar tissue is. You know that? It's so fascinating if you watch it. Well,
Oh.
you've seen it. But
Blows me away, my friend. We got someone from Boca Raton, right around the neighborhood.
Yeah.
John from Boca Raton writes, I've been teaching tennis for over 20 years and now find myself unable to go to work. My elbow is inflamed and hurts when I try to extend it. I've been given medication to help with the pain. Not good, John. But it works a short time and returns. I have clients who have told me about you, and I saw your shows on the website. How would you cure a tennis elbow situation? Oh, that's how to cure a tennis elbow. That's like in one shot, maybe 2 shots.
well, you need a diagnosis
yes.
first. If he can't
Extend
his
Maybe it's
arm,
not the elbow, right?
then it's inside the ligament structure. So we can handle that with the C-arm.
What amazed
You have to have the tools. To
Yeah.
do it. I mean, we're not just whistling Dixie here. We have the tools to do it, and you get relief right then and there. I mean, right now.
he gets back to work.
Well, you amaze me. I'll tell you why. Not too long ago, maybe 8 months ago, when Leah, who does his commercials, came in, and I keep repeating this because that's what totally amazed me, that this guy really, really knows his stuff. He's not just whistling Dixie. Could you whistle Dixie, by the way? No. Way down yonder the way. Okay. So here's someone that was going, I think she saw Dr. Pannozzo either a Tuesday or a Wednesday, and she was going, I think, Thursday to get a shot in her ankle for a terrible ankle. And Leah is an athletic girl. She runs. She goes surfing with the kids. I mean, she's like athletic, works out at the gym. And Dr. All he did was this. I remember it like it was yesterday. I'm saying to myself, what's she going to do now? And as she walked, Freddie, he said, "It's not your ankle." And I said to myself, okay. So he gave her a shot in the back, right? Was it the left side? I don't remember. He gave her a shot in her back, and she started walking again, and she was walking straight.
Right.
And to this day,
True story.
never put a boot on, never went back to the baton. So that to me is amazing. So someone comes in with an ankle problem or a knee problem, it might not be that might not be the source of where that pain is coming from. So I mean, how did that cause the ankle problem? Because she was walking.
No, it's a referred pain. It's
Right.
From somewhere else.
Okay, and that's amazing. So we're not. I mean, the doc looks like he's 40 years old, and he's really 97, but he takes care of himself. So the main thing is, if you have any kind of pain, just come. Look, you can come in. We don't even put your name on the clipboard. Sit down and relax and watch our TV show. We run it 24/7, and sit and talk to people. Like that's how I found you. I sat and started talking to. Well, my problem was Freddy. We had to wait outside until someone got up to see him, so we could sit down. And remember that Freddie and I were looking and saying, "Oh my God!" So I convinced Freddie to go for his pain first.
Yeah, I remember that.
Yeah, I wanted Freddie to go first because I'm a baby, and then I went afterwards, and then everybody else at the radio station went after that and after that. I mean, it was amazing because.
Well, I got to meet some new people that came in to. We were setting up the. TV,
Oh yeah, you always
there was
gonna
a
meet new
lady
people.
there, and she said, "Well, this is my first visit here, and I'm a little nervous." I said, but she says, watching the TV show, it makes a lot of sense what he's saying. And I don't know why I don't even know why she was there. But then there was another gentleman who you've been treating for a long time for different things. I said to him, "You're back again. Are you back for anything he worked on in the past?" He said, "Oh, no, not at all. Every time I hurt myself is because he's giving me the ability to be more flexible, and he's doing more things with his life."
But I know the guy. He had so much pain everywhere. You know the guy that wrote that had that little brochure he made for you. I don't want to mention his name, but he actually had pains in his neck, had pains in his leg, had pains in his hip, and you know what? He told me, he said he was always diagnosed with a wrong diagnosis. And when he got these things fixed, well, perfect one is the guy he sent in with his two knees, ready for this? #1 doctors in Denver. #1. They're so busy that no one could see him. So what happened was, after 2 unsuccessful operations, he is now playing tennis. I saw him Saturday at the gym. You know what he said? In his southern accent, I was like, "I'll tell you, folks, that doctor knows his stuff." He said, "I didn't bring no MRI because you told me not to, and I'm playing tennis." Now he's not coming to see you for a while because his knees are perfect. He's playing tennis every day and playing golf, and no problem.
Yeah, post-op pain from a knee.
No problem.
Is just scar tissue. That's
Right.
all. Don't let the surgeons frighten you to death like it has to be replaced and it's a failure of this, failure of that. It isn't. It's just scar tissue. That's all. You work on that first, get the motion back, and there's no knee there, so can't be a knee.
Mm-hmm.
So what else is there?
Scar
the
tissue.
metal doesn't interact. So what do you have? Scar tissue.
And this is not a dumb guy. This guy is a graduate from the top schools in the world, Annapolis. So these guys know. It's
well,
funny.
It's a lack of education about
Exactly.
what the body does, and they don't teach it. They don't teach it in high school. They should teach it in high school.
We can make. Fred, I got an idea. We take all those 96,000 knees every year that they throw away. We build a statue of Dr. Pannozzo.
Out of knees?
Out of knees. We got
All right, moving
we
on.
got some of the
Moving
sculpture,
on.
and we
This
go
guy's
like this.
crazy.
No more knee
No,
surgery.
you're nuts. I ain't doing that.
Okay, you don't want to do that?
No, I don't want to build a statue of Dr. Pannozzo that made of knees.
Yeah, Doc. What do they do with all those knees?
I think they burn them.
Really? Are those got to be hard to burn a knee?
Moving on.
Okay, next question. I'm trying to help Freddie make a couple bucks. He's got a kid in college. Rebecca from South Carolina writes, "A friend of mine turned me on to your show, and I find your information both funny and interesting." Okay. "I suffer from migraine headaches and have been told that you can cure this pain and it won't come back. Is this true? And if it is, has no one ever come back because of the migraine continues?"
No, nobody's come back, and it's true.
Well, you know what it is? Source of the pain.
It's a source. You have to have a source. We do the same thing with ankles and knees and low backs and between the shoulder blades and shoulders.
So
I mean,
what
it's
about
a source.
migraine medication? Why do they sell that? Does it
Because
work?
people keep buying it. That's why.
That's a good point, huh? Let me think of that one.
Yeah, but the bottom line is, I can understand. I've known people that had migraine headaches that they'd sit in the bathroom with the doors closed because they were thrown up. I mean, they were bad, and they would take that Sumatriptan, which is a shot, and the pain would go away. But they had to walk around with this medicine wherever they went in case it came back again. But what you do, and I want to, it never comes back.
It never really leaves.
No, that's
you
what I
just hide it for a while.
Right, it's hidden.
There's talk about critical thinking.
Mm-hmm.
You know, we teach critical thinking here. This is what all this is about. Critical thinking. You ever see the advertising for the walk-in tub?
Yeah.
Oh yes.
Do you know what you have to do with that?
No.
You walk in and you close the door, then you sit there until the water comes up. And then you can't get out of that till the water goes down.
That's exactly right.
Because the door is holding the water.
Right, that's exactly right. The walk-in
So why
tub.
would you want to buy something like that? You got to be nuts. You know, it's just.
How about the new back thing that goes on your back and it emits electronic heat to get rid of, quote, the pain in your back?
No, you mean what's advertised as electronic thing? You
Yeah.
press the button and
Yeah.
that doesn't.
You're gonna electrocute yourself with that.
And now those
Battery operated.
Wait, there's a new one with the catalog that comes out to relieve migraine. It's a thing that goes over your head, and little things go like this on your head. You know, could they see me? Goes beep beep
Now,
beep
did you
beep.
listen to the advertising for that thing that goes on your
Yep.
arm? Okay, if you listen close, it doesn't cure anything.
No.
It temporarily
Right.
relieves. That's what he's telling you. And you're going to spend $600 on that?
It's like that new cream that came out. It was made by kangaroos. The kangaroos didn't actually make it. It's something from a kangaroo. That when you rub it on your arm, it's like Ben Gay type thing.
Emu?
Yeah, the emu. That's the one.
Emu.
Thank you.
What
yeah.
is that? That's a bird.
Oh, really? Oh.
A kangaroo.
Well, it was from Australia. I think it was a kangaroo.
What about where they freeze your body that all the NBA basketball players are using?
Two people died from that thing.
What?
Yeah, 2 people have
Cryogenic.
that. Yeah.
Cryogenic. Well,
They
that's
free-
stupid.
They
Don't do
freeze the body to like minus 20 degrees.
What is that supposed
What
to
was
do
it
for
that?
you?
I don't know.
And all the blood goes to the organ, so that's supposed to help you.
That's so stupid. You can't even believe that they even talk like that. Who talks like that?
Well, you should see the NBA. The Phoenix Suns, every player,
LeBron James uses it.
you can't use the name. I got to let it stop.
Oh, I'm sorry. I didn't say that. Okay. What about the other thing that
You can use the name because it's a public figure.
Yeah, but he's
And you're not lying.
But he never gave permission to say that.
Yeah, I
Well,
apologize.
he doesn't have to. He's a public figure.
Yeah,
that
but
went through the
he
Supreme
doesn't.
Court.
He's saying that he doesn't use it.
He's saying he doesn't use it. Okay.
Okay. What I'm trying to
So
visualize.
now we corrected it.
That's right. So we're correct. We
what
stand
I'm-
correct.
yeah, What I'm trying to realize is how does that get rid of your pain? I mean, I would.
All the blood goes to the organ because you're freezing the whole area. I don't know. It's just crazy.
No, I don't know if I could sit somewhere at that degree of
No, you
temperature.
can't.
I would
wouldn't
get a
let you.
heart attack.
I would shoot you myself.
Yeah.
Oh, Doc, I'm gonna pay him to go see you watch you shoot him.
Hey, look. Here's what I can tell you. Anyone that can get rid of a groin pain in 2 shots is my guy. Because no one knows what that pain is unless you're
Yeah, can
suffering
you
from it.
imagine freezing the groin?
I don't want to get into this guy because I don't want to get into trouble.
But how does that
Have your
work?
finger on the button.
You got another question or?
I got 1 minute. Okay, Doc, I'm going to give you a short one that you can answer 1 minute. Okay. Mary from Atlanta writes, I have pain in both my feet and I have diabetes. They say I have something called neuropathy and the pain is common and is caused from diabetes. Is there something you can do to help me with this pain? Burning, tingling makes me fall asleep at night. Almost impossible to get rid of or sleep.
It is not from the diabetes. The neuropathy does not hurt. It's a dying back. It's less symptomatic, not more.
So all you people that
It's been misapplied by the drug companies. They want you to buy this drug because neuropathy is painful, and it is not.
All right, we gotta go.
561-381-5800. Another great show with Dr. Pannozzo, Freddy Santori, Gio, Linda, and that pretty girl who looks homeless, Colleen. Thank you so much, everybody. We'll see you Sunday.
This has been the Dr. Pannozzo Sports and Medicine Hour with Dr. Anthony Pannozzo. If you spend 5 minutes with Dr. Pannozzo, you'll see he genuinely enjoys helping others. Visit Dr. Pannozzo online at www.paincentersnationwide.com or call him at 561-381-5800. Dr. Pannozzo will consult with you to determine the best solution to your pain needs. 561-381-5800 is the number to call, even if it's just for a second opinion. Join Dr. Pannozzo next week when he brings you more important information on the physics of weight-bearing and engineer concepts for the body.